So this pandemic has brought a lot of change for all of healthcare, but we haven't often spoken to our patients about what that means for those who are waiting for an operation or those who have to undergo an operation. So Carrie, to start with you, could you give us your views on what you think the main anxiety is for patients as this pandemic has unfolded and is unfolding?
It's really hard to pin it down to one main anxiety. I would say there's several, personally, but if I had to choose one, I think up there is the uncertainty of everything, and the sheer anxiety over what it means about keeping safe, and being safe, and how that would impact any surgery that you may have to have during a pandemic. I think there's just so many things that just would make one very anxious. And I think keeping safe and what would happen, what wouldn't happen, all the things that we included in our patient information booklet with COVID surge.
In your experience, Carrie, do you think patients and people are worried about coming into hospital for an operation more so than they were worried before the pandemic?
I think people are absolutely terrified. Naturally, I don't speak for the whole public, but certainly anyone that I've come across, friends, family, or just anecdotal or reading on social media, and the work that we have done in the patient and public engagement group, people are terrified because this is a killer virus out there. It's not gone away. And it's a very scary time for everyone concerned, including I'm sure people who actually work in hospitals or work in healthcare themselves.